Welcome back to the Elephant Zone. This is a mission to assist another endangered elephant, which is in critical condition after being shot by a cruel poacher. The elephant is also suffering from a painful abscess at the site of the gunshot wound. A villager who had gone to the forest in search of some medicinal plants noticed a poor elephant limping around, unable to endure weight on its right back leg. He made an emergency call to the Wildlife Conservation Office. That is how the officials got to know about the poor being. Soon, they were able to locate the elephant, which was limping and struggling to bear the pain from a severe abscess in its leg. Observing the severity of the elephant's condition, the veterinarian decided it would not be wise to sedate the animal in its current state. Instead, he determined that on the first day of treatment, it would be best to administer antibiotics to reduce the severity of the wound and help energize the elephant. On a later day, when the elephant had regained some strength, the veterinarian planned to attend to the wound. He chose the remote injection method to administer the medicine. According to this method, a tranquilizer gun is used to deliver the required medication. Instead of sedative drugs, the dart of the tranquilizer gun is filled with antibiotics and other essential medicines. These medicines are injected directly into the animal's bloodstream, ensuring rapid and efficient delivery of treatment without the need for physical restraint or close contact. After the treatment was made, they left the location after assigning a ranger officer to monitor the elephant's behavior. The wildlife conservation team once again received an emergency call the next day. That was a call from the ranger officer. He explained that the poor creature had fallen in a muddy paddy field and needed help immediately. It turns out that the elephant had been drinking water when it collapsed there. The veterinary officials and other officers rushed to the scene immediately, armed with the essential medical equipment. Officers noticed that the elephant was isolated in the muddy surroundings with a swollen leg. It is in a very horrible condition. The legs were tied with a rope, as the elephant was not sedated. This method could ensure the safety of the individuals involved. It is identified that the elephant has sustained a gunshot wound, and now it has turned into an abscess. Then they started treating the wound. Cleaning the elephant's abscess is an important part of the medical treatment and must be completed correctly. That is why the team works so hard to clean the wounded area thoroughly. Some officials methodically clean the pus-filled abscess by pushing out all infected tissue. They first injected saline solution, then thoroughly cleansed the region with cotton swabs and forceps, and finally injected disinfection solution. This could help them thoroughly clean the pus-filled abscess. They made the effort to inject disinfectant solution multiple times to clean the wound thoroughly. The doctor inserted a cannula into the ear vein to inject saline after cleaning the ear. The elephant was given about 10 bottles of saline solution to improve its condition. In the meantime, some medicine was administered through the cannula, which was inserted earlier. Once the wound was deeply cleaned, povidone iodine solution was injected into the wound. Veterinary doctors and wildlife conservation teams encounter enormous challenges when treating elephants and gunshot wounds. Due to their size and habitat, providing medical care could be quite challenging. However, these officials are the ultimate life saviors of these wild animals. They are always ready to bear any risk to protect these poor creatures. Then, Negasant powder and antibiotic powder were also applied to it. Cotton was also used to cover the wound after the medicine was applied to prevent it from spreading around. Finally, an antibiotic spray was sprayed on the treated wound. Now the officials inject some of the medication. Painkillers, antibiotics, multivitamins, and anti-inflammatory medications are among them. The veterinary doctor decides the appropriate dosage of drugs. A gunshot by a cruel individual has caused harm to this poor animal. Gunshots are a horrible result of human-elephant conflict. Elephants, as majestic and intelligent creatures, have long been targeted for a variety of reasons, including the illegal trade of ivory tusks, or even to protect plantations from elephants. Nonetheless, extensive investigations are being conducted to bring justice to any criminals responsible for such cruel and dangerous acts. Despite their greatest efforts, they are unable to move the elephant from the muddy field. So, they left the elephant there, knowing that the elephant would move once the medicine started to respond. An officer was assigned to monitor the animal. After a few hours, the officer who was in charge of the elephant informed the team that the elephant had moved back to the forest.